What if I told you that your body has been sending you urgent distress signals for months, maybe even years, and you've been completely ignoring them? Not because you're careless, but because nobody told you what to look for. Your kidneys are two of the most hardworking, underappreciated organs in your entire body. And right now, there are millions of people walking around with failing kidneys who have absolutely no idea. I'm going to change that today. In this video, I'm going to walk you through 17 warning signs that your kidneys may be in serious trouble. Some of these are things you can see in the mirror right now. Others are things you feel at night when everyone else is asleep. And a few of them are so unexpected that most doctors don't even connect them to kidney disease right away. Stay with me through this entire video, because the signs that seem the most harmless are often the most dangerous.
Before we get into the warning signs, let me quickly explain what your kidneys actually do, because most people dramatically underestimate them. Sitting just beneath your rib cage on either side of your spine, your kidneys are roughly the size of your fist. Every single day, they filter about 200 liters of blood. That's enough to fill a large bathtub. They pull out waste, toxins, and excess fluid, send the garbage to your bladder as urine, and return the clean blood back into circulation. But here's what most people don't know. Your kidneys also regulate your blood pressure, control your red blood cell production, balance the acidity of your blood, manage your electrolytes like sodium and potassium, and even influence your bone strength. They're a full command center for your body's chemistry, and when they start to break down, the ripple effects touch almost every system in your body. Now, here's the terrifying part. Research suggests that up to 90% of people with chronic kidney disease, CKD, don't even know they have it. The disease progresses silently, and symptoms often don't appear until you've already lost 60 to 70% of kidney function. That's why knowing these signs isn't just educational. It could literally save your life. Let's begin. Sign number 1, fatigue that never goes away. We're starting here because this is the number one complaint I hear from patients with kidney disease, and it's the most commonly dismissed. Everyone feels tired. Truly, everyone feels tired. But kidney-related fatigue is different. It is a bone-deep exhaustion that weighs you down, that doesn't improve with sleep, that makes a simple flight of stairs feel like a mountain, and that follows you every single hour of the day. Here is why it happens. Let's look closer. Your kidneys produce a hormone called erythropoietin, EPO, which signals your bone marrow to manufacture red blood cells. You may have heard of EPO before. It's the same substance that cyclists like Lance Armstrong famously abused to enhance their athletic performance. When EPO is high, you produce more red blood cells, and more oxygen gets delivered to your muscles and organs. But when your kidneys are damaged, they stop producing enough EPO. Red blood cell production drops. Your blood carries less oxygen. Every organ in your body starts running on fumes. This condition is called anemia of chronic kidney disease, and it's one of the most debilitating consequences of kidney failure. The good news is it's one of the most treatable. Synthetic EPO injections can reverse a significant portion of the fatigue associated with kidney disease. Sign number 3, swollen legs, ankles, and puffy eyes. Here's a simple test you can do right now. Roll up your pant leg and press your thumb firmly into your lower shin bone for 5 seconds. Now release and look at the skin. Did it leave an indent? If it did, that's called pitting edema, and it's a classic sign that fluid is accumulating in your tissues. To understand why this happens, we need to talk about albumin, a protein in your blood that acts like a sponge, holding fluid inside your blood vessels. When your kidneys are healthy, albumin stays where it belongs, in your blood. But when the filtration system breaks down, albumin leaks out through damaged kidney filters into your urine. Sign 4, foamy or bubbly urine. Pay attention next time you use the bathroom. Normal urine can produce a few light bubbles that disappear within seconds. But if you're seeing a persistent thick layer of foam, like the head on a poured beer, that's a sign something is wrong. That foam is albumin. It is a sign. Because albumin has a soap-like molecular structure, when it leaks into urine in significant quantities, it creates that characteristic frothy appearance. Clinically, this is called proteinuria, protein in the urine, and it's a hallmark sign of kidney damage. At the filtration level, what's happening is this. Your kidneys contain approximately 1 million tiny filtering units called glomeruli. Each one is a tightly packed bundle of microscopic blood vessels wrapped in specialized cells. When those cells, called podocytes, become damaged or inflamed, the filtration barrier develops gaps. Albumin, which is normally too large to pass through, starts slipping through these gaps and ends up in your urine. The amount of protein in your urine can actually indicate how severe the damage is. Normal protein loss is under 150 milligram per day. Moderate kidney disease may show 500 milligrams to 1 gram daily. In severe cases, patients lose over 3 grams of protein per day, a condition called nephrotic syndrome. If you see persistent foam in your toilet, don't ignore it. Sign number 5, skin that won't stop itching. Imagine an itch so intense and so relentless that it keeps you awake for hours every night. You scratch until your skin bleeds. You try every lotion, every antihistamine, every home remedy, nothing works. This is uremic pruritus, whole body itching caused by the accumulation of waste products in the blood. When the kidneys can no longer filter them out effectively, it's one of the most distressing symptoms of kidney disease, and it's often one of the first serious signs that something is wrong. The mechanism is complex. Uremic toxins deposit directly into the skin, causing local irritation. They also activate an itch receptor called PAR2, which hypersensitizes nerve endings throughout the body. Over time, these toxins can even cross into the brain and chronically activate the brain's itch processing circuits, creating an itch that has no external cause and no external cure. The only real solution is to address the kidney function itself. Sign number 6, metallic taste and loss of appetite. Imagine sitting down to your favorite meal, something you've always loved, and the moment it hits your tongue, all you can taste is metal, like licking a cold, hard silver coin. This is one of the most unusual and distressing symptoms of advanced kidney dysfunction, and it has a very specific cause. When urea, a nitrogen-containing waste product that healthy kidneys excrete, builds up in the blood, some of it migrates into the saliva. Bacteria naturally present in your mouth, then break this urea down into ammonia and other nitrogen compounds. These byproducts directly stimulate taste receptors on your tongue, producing that distinctive metallic flavor. The same process gives the breath a distinctive ammonia-like odor that clinicians call uremic fetor. If someone tells you that your breath smells unusual despite good oral hygiene, sign number 7, muscle cramps, especially at night. If you've ever been jolted awake by a vicious cramp in your calf or foot, you know how agonizing it can be. For people with kidney disease, these nighttime muscle cramps can become a nightly torture. The kidneys are the master regulators of your electrolyte balance: calcium, magnesium, potassium, and phosphate. When kidney function declines, this balance gets disrupted in several interconnected ways. First, rising phosphate levels in the blood trigger a hormonal cascade. High phosphate stimulates the release of FGF23, a hormone that attempts to force the kidneys to excrete more phosphate. But FGF23 also suppresses the conversion of vitamin D into its active form. Without active vitamin D, the intestines absorb less calcium. Blood calcium levels drop. Low calcium makes nerves and muscles hyperexcitable, producing painful, involuntary contractions. Second, kidney disease often causes low magnesium levels. Magnesium acts as a natural muscle relaxant. Without it, muscles stay tense and prone to cramping. Third, rising acidity in the blood, a condition called metabolic acidosis, further destabilizes muscle cell function, contributing to cramps throughout the body. Sign number 8, restless leg syndrome. Restless leg syndrome, RLS, is a deeply uncomfortable neurological condition characterized by an irresistible urge to move your legs, usually accompanied by crawling, tingling, or burning sensations deep inside the limbs. Symptoms are almost always worst at night when you're lying still, making it nearly impossible to fall asleep. The leading theory behind RLS is iron deficiency in the brain. The brain requires iron to produce dopamine, a neurotransmitter that helps regulate movement signals. Without enough dopamine, the motor control circuits misfire, producing that maddening, restless sensation. Sign number 9, changes in your nails. Look at your nails carefully right now. It's completely normal to see a faint pale crescent at the base of each nail. That's called the lunula, or little moon. It simply represents newly forming nail that hasn't fully hardened yet. But patients with chronic kidney disease sometimes develop what's called half-and-half nails, also known as Lindsay's nails. In this condition, the lower half of the nail appears pale or white, while the upper half takes on a brownish-red discoloration. Unlike a normal lunula, the line between the two colors is sharp and distinct, and it affects the whole nail. We don't fully understand the mechanism behind this change, but the clinical association with kidney disease is well established and documented across decades of medical literature. It appears to be related to increased melanin deposition and changes in blood flow to the nail bed caused by uremic toxins. Not every person with kidney disease will develop these nails, but if you notice this striking two-tone pattern, especially paired with any other symptoms on this list, it warrants immediate medical investigation. Sign number 10, easy bruising and bleeding gums. Do you bruise from seemingly nothing? Large purple or yellow bruises appearing on your arms and legs without any clear injury? Do your gums bleed more than usual when you brush your teeth? Do you get nosebleeds that seem disproportionate? These could all be signs of kidney disease. Here's why. Your blood's ability to clot depends heavily on platelets, tiny, specialized cells that rush to any site of injury and aggregate together to form a clot plug. Think of them as emergency repair crews. Normally, they're sticky and fast-acting, Sign number 11, high phosphate and calcinosis. Here's a symptom that surprises most people. Some patients with advanced kidney disease develop small, hard, whitish yellow lumps just beneath the skin, particularly around joints, on the fingers, or on the ears. These bumps are painless and feel almost rock hard when you press on them. This is calcinosis cutis, calcium phosphate crystals depositing in the soft tissue. It happens because failing kidneys can no longer excrete excess phosphate efficiently. Blood phosphate levels rise. Phosphate binds to calcium to form calcium phosphate crystals. These crystals, now circulating in excess through the bloodstream, begin depositing wherever blood flows, including the skin. Occasionally, these deposits can rupture through the skin surface, releasing a thick, chalky paste that resembles toothpaste. But the truly dangerous version of this phenomenon is when calcium phosphate crystals deposit inside blood vessel walls. Sign number 12, weak bones and unexplained fractures. When calcium levels fall due to the phosphate FGF23 vitamin D cascade, as we discussed earlier in our series, the body activates an emergency response. It releases parathyroid hormone, PTH, which commands bone cells to break down bone tissue and release the stored calcium into the blood. Short-term, this stabilizes blood calcium. Long-term, it destroys your skeletal integrity. Months to years of chronic PTH elevation, a condition called renal osteodystrophy, leads to progressively weaker, thinner bones. That fracture under minimal stress. One underappreciated sign of this is height loss. When vertebrae in the spine gradually compress and fracture, patients can lose 1, 2, or even 3 inches of height over time. This is not normal aging. If you or someone you know has lost significant height without explanation, it should trigger a full and thorough medical evaluation. That includes kidney function testing. Sign number 13, shortness of breath. We've already established that fluid can escape blood vessels and pool in the tissues of the legs and feet. But in more severe cases, that same fluid can accumulate in the lungs, a condition called pulmonary edema. When fluid fills the tiny air sacs of the lungs, gas exchange becomes compromised. Oxygen can't enter the blood efficiently. Carbon dioxide can't exit. The sensation is one of suffocating while breathing, a desperate, frightening inability to get enough air even while lying still or doing minimal activity. Pulmonary edema from kidney disease is a medical emergency. But even before fluid reaches the lungs, anemia from decreased EPO production can cause significant shortness of breath on exertion, because less oxygen is being carried by the blood. If you find yourself becoming breathless from activities that used to be effortless, kidney function should be on your differential list.
Sign number 15, pericarditis, inflammation around the heart. One of the more serious and painful complications of advanced uremia is pericarditis, inflammation of the pericardium, the thin fibrous sac that surrounds and protects the heart. Unlike most inflamed tissues in the body, the pericardium can't simply rest and recover. The heart beats approximately 100,000 times per day, and with each beat, it rubs against the inflamed pericardial tissue. This creates intense, sharp chest pain that worsens with deep breathing and lying flat. When doctors listen with a stethoscope, they can hear a characteristic scratching or creaking sound, called a pericardial friction rub, created by the two inflamed surfaces moving against each other. Uremic pericarditis is a sign of severely elevated toxin levels and typically indicates the immediate need for dialysis.
Sign 16, difficulty concentrating and brain fog. Brain fog is often dismissed as stress or poor sleep, but in the context of kidney disease, cognitive impairment has a physiological basis. Uremic toxins that accumulate in the bloodstream are capable of crossing the blood-brain barrier, where they interfere with neurotransmitter function, cause neuroinflammation, and impair synaptic signaling. Patients describe this as feeling like they're trying to think through thick cotton wool. Difficulty concentrating, poor short-term memory, slower processing, and a general mental dullness that progressively worsens as kidney function declines. Combined with the sleep disruption caused by nocturia, restless leg syndrome, muscle cramps, and itching, the cumulative cognitive burden of kidney disease can be profoundly disabling even before the kidneys reach complete failure. Sign number 17, no symptoms at all. This may sound like it contradicts everything I just said, but please hear me out for a second, because this might actually be the most important sign on this entire list. Chronic kidney disease is classified into 5 stages, based on the glomerular filtration rate, a measure of how efficiently the kidneys are filtering blood. Stage 1 represents very mild damage with near normal function. Stage 5 represents advanced kidney failure, requiring either dialysis or a transplant. The brutal truth is that the majority of people with stage 1, 2, and even stage 3 kidney disease experience absolutely no symptoms whatsoever. The kidneys have enormous functional reserve. They can lose more than half their capacity before any noticeable symptoms emerge. By the time most people feel sick enough to seek medical attention, they're already in the advanced stages. This is why routine testing is so critical. A simple urine test can detect albumin leakage. A basic blood test can easily measure creatinine, and then calculate your final GFR. These inexpensive and accessible tests can catch kidney disease years before it becomes life-threatening. Hello, what causes kidney disease? The two biggest culprits responsible for the majority of chronic kidney disease worldwide are diabetes and high blood pressure. Chronically elevated blood sugar, as seen in type 2 diabetes, directly damages the delicate blood vessels of the glomeruli, destroying the kidney's filtration capacity over years. Uncontrolled high blood pressure similarly injures those same tiny vessels, and scarring the filtration units, and progressively reducing kidney function. Both of these conditions are largely preventable and highly treatable. Managing blood sugar through diet, exercise, and medication, and controlling blood pressure through lifestyle changes and antihypertensives are the single most powerful things you can do to protect your kidneys.
What to do right now? Act now for your health. If you recognize several of these signs in yourself or someone you love, don't panic, but don't delay either. The most important step is to see your doctor and ask for 2 specific tests: a urine albumin to creatinine ratio, which checks for protein leakage, and a serum creatinine test with estimated GFR calculation, which measures how efficiently your kidneys are filtering. If you're diagnosed early, even at stage 1 or 2, there is a real evidence-based opportunity to slow or even halt the progression of kidney disease through dietary changes, blood pressure management, blood sugar control, and targeted medications. Your kidneys have been quietly working for you every second of every day. Since before you were born, the least you can do is pay attention to what they're trying to tell you.